Hello, this is the breast and testicular exam self-learning module. There's no grade or attendance credit given for participating in the module, but it does contain important information that you'll need to know as far as going forward being a nurse, and within this class, examination questions and potentially checkoff. So it is important that you participate. We are also going to be able to track your participation should there be a question on content covered for exam questions and so forth. So we'll be able to look back and see who did participate and who did not. So it's important that you do so. There are parts that will ask you to log in to something called Edpuzzle. If you're not in my blended class, this will be new for you. So what you need to do is simply create an account. It's free when they ask you to, and make sure you put your first and last name, and then you'll be able to answer the questions. So we're going to start with the breast. And you should be familiar with normal breast anatomy from your A&P class, so you want to refamiliarize yourself with these components. Certainly understanding that there are lymph nodes that go up into the axilla. This breaks the breast area into quadrants, so you should be familiar with the fact that closer to the axilla is the upper outer quadrant, and then we've got the upper inner quadrant, lower outer quadrant, and lower inner quadrant. So that's important to know for when you are teaching a patient about self-breast exam. I also want to mention that the reading in the book talks about conducting an exam on your own. That is generally not done by a registered nurse. You certainly should be familiar with how to do it from the reading, but I'm going to focus on teaching patients about how to do a self-breast exam because that's going to be more within your scope of practice. This slide gives you an overview of what we would be looking for as practitioners, and also what we want to educate women and men get breast cancer too, on what they would want to be looking for. So the first illustration talks about a lump or hard knot or thickening inside the breast or underarm area. So here you can see that's the upper outer quadrant near the axilla. Any kind of swelling, warmth, redness, or darkening of the breast should certainly be investigated. Change in size or shape of the breast. And the key word here is change. If somebody already has asymmetry and has, all his or her life, then it's not something that we would be concerned about. But a change where it was not asynchronous before, or I'm sorry, asymmetrical before, should warrant an investigation of some sort or assessment. Dimpling or puckering of the skin, itching, scaly sore or rash on the nipple, pulling in of the nipple or other parts of the breast, so you can see that there's a difference between this nipple and this one. Nipple discharge that starts suddenly, that's unrelated to breastfeeding or lactation. New pain in one spot that does not go away. So these would be something that we would want to talk about with women and men if we're discussing self-breast exam. So earlier I talked about understanding the different quadrants of the breast. You should know that most cancers occur in the upper outer quadrant of the breast. Okay, so that is an area of focus that we would want to talk to women about, and again, men, to make sure that they're palpating that area very well and getting up under the axilla. Then the second area would be the inner quadrant, upper inner quadrant, with 15% of breast cancers. And the nipple area, we've got 18%, 11% the lower outer, and the fewest occurrences, the lower inner quadrant. So be aware that the breast for the left or the right, most breast cancers occur in the upper outer quadrant. This slide contains a video that talks about teaching patients about self-breast exam.
Hi, my name is Melissa Carr, and I work for Kentucky Cancer Link, a nonprofit whose mission is to reduce barriers to screening, diagnosis, and treatment of cancer. I'm also a breast cancer survivor. In 2012, I found a lump in my breast through a self-breast exam, and I really feel strongly about how important this is and knowing the proper way to do it. I'd like to introduce someone who's going to provide us with that crucial information.
My name is Eleanor Broadus. I'm a breast navigator. I'm certified in navigation for breast health, and I'm also certified in teaching breast self-examination, and that's what we're here today to talk about.
Thanks so much, Eleanor. I'll leave it to you.
Okay, so let's get started. Let's learn how to do it. There are two vital parts. We have to see, we have to feel. We definitely need to look at our breast. So we need a mirror, and we need to look at our bodies. We need to know our bodies. So when we look at our bodies, we're going to be looking at the front of our breast and each side, right and left. We're going to be looking with our arms down, front view, left and right in the mirror. Then we're going to be looking with our arms on our hips, and we're going to project our breasts out, right and left. And then we're going to look with our arms all the way up, because we need to see the underside of our breast. A lot of women have very pendulous breasts, and sometimes you may even need to lift them up, but we need to make sure that there's nothing going on the lower side. The last way we're going to look is we're going to actually bend over, and the way our breasts hang, that's important. We need to remember that our breasts are like our eyes. I have a picture of a set of eyes up here. Our breasts should be identical. If one breast is doing something, the other should be doing it also. So if you see one doing something different, hanging different, nipple pointing a different direction than the other breast, that's a red flag, and you need to contact your physician. Something's not right. So we're looking for lumps, we're looking for dimpling, we're looking for changes in the skin, inverted nipples, scaly nipples, and spontaneous discharge. Lumps, bumps, anything that looks unusual, any change in a breast, you need to notify your physician. Dimpling, indentations, anything that is pulling inward, you need to let someone know about. Changes in the skin, that could be redness, even a stretching type of sensation that you might notice, a swelling. One breast is getting larger than the other. Change in texture, it feels like an orange peel. Sometimes that can be very unusual in the breast, but that is also a sign of a certain breast cancer. If you have one nipple that inverts and the other does not, some women have inverted nipples and that's their norm. So that's not something we're concerned with, but if you have one nipple that inverts all of a sudden, all on its own, and it's never done that before, that can be a concern. Scaly nipple, that may be something that is a dermatology type problem, but it could also be a certain type of breast cancer. So you need to follow up on that. Discharge is something that women get real concerned with, but we need to pay attention to that. Is it at a certain time? Is it a certain color? And how much of it? So it's spontaneous. It's not something that you force. It's something that you just find in your bra or on your night clothes, and you need to let your physician know about it. Pay attention to your body. Know your own body. Now, it's also important what you feel, so you need to use your hands. In looking at the feeling of your body, we need to know how to do this. So I've got a model here that I'm going to hold up so we can look at, but you need to know these 7 P's, the position that you need to lay in, because we used to always do self-breast exams in the shower, and we no longer do that. We haven't done that for several years. We need to know the parameter. We need to know the pattern in which to examine. The palpation. How do we palpate our breast? And how much pressure do we put on our breast? And how do we practice, and how fast do we go? So the position is lying down. We get into what we call a K-hand position with our arm above our head. We can lay it on our head, and then we're going to do an exam with the opposite hand. This hand is going to come over, and we're going to start up underneath our arm. Next, we're going to know our parameter. The parameter goes from the center of our chest all the way up underneath our arm to our collarbone, this clavicle up here, underneath our breast, which is called the bra line. So this is the complete area. In years past, we just went round and round on top of the breast tissue on that mound of tissue. But no longer. We need to check everywhere because we have lymph nodes and some breast tissue that surrounds the breast that we need to be checking. The pattern is no longer just one big circle. We're going to be doing circles, but we're going to be doing small circles, but we're going to be using mowing the lawn pattern up and down, back and forth. So we're going to be walking our fingers. We're doing these dime-sized circles. This is what is so different. We're using the pads of 3 fingers from the joint to the tip of your finger, and you're going to start up underneath your arm because you have lymph nodes there. So once you get your hand back over your head, go right up underneath your arm, and you're going to make, and I'm going to show you how to do that. I'm going to show it where you can see it. You're going to take your 3 fingers and you're going to go white, dime-sized circle, then you're going to go deeper and then deeper. Then you're going to walk a finger and you'll slide the other 2 fingers to meet. Light, medium, deep. Walk your finger, slide the other 2, light, medium, deep. Walk, slide, light, medium, deep. Walk, slide, light, medium, deep. Walk, slide, light, medium, deep. When you get to the bra line, you're going to slide over a finger's breadth, light, medium, deep, and then you're going to walk your way back up, slide over, back down, back up, slide, back down, slide, back up. When you get to the nipple, then your arm can come down, and then you can finish the rest of your exam with this hand over to the center of your chest. Works very, very well, and you will have done a complete exam. Now, it takes a little bit longer than doing that shower exam, just going round and around, but you only do it once a month, and you are worth it. Practice makes perfect, so the more you do it, the better you're going to get, the faster you're going to get, and you're going to get to know your breast, and it's going to be a good experience because you're going to be aware of any change that your breast may have. And that's what you're going to need to know, what your normal breast feels like, and if there's any change from month to month, and then you contact your physician. BSE does save lives. Know your breast, call your physician, don't panic. Most things that we find in our breast are not cancer, but you need to be your own advocate. You're worth it.
So I think she does a good job teaching you how to do a self breast exam, and hopefully you in turn would be able to read that and relay that information to patients. And it depends where you work as to whether or not you would be educating patients, but it's definitely knowledge that RNs need to possess. All right, so we're moving on to normal male reproductive anatomy. You should certainly be familiar from the A&P class. We're going to focus on teaching a man self-testicular exam, and when you see the video, you'll see that they're using the same models that you'll be using in class. So make sure that you're familiar with the normal anatomy. You can see here that one testicle tends to be a little bit lower than the other, and that is normal. That would not be any cause for concern. So you want to make sure that you're familiar with those types of landmarks. This picture just gives you an idea of where I should say, a testicular tumor would be located. Here you see a healthy testicle, which would of course be housed by the scrotum. And this one shows where the tumors may be located. So again, it's housed by the scrotum, but you certainly would be able to palpate lumps and abnormalities of the testicle through the scrotum. So cultural considerations for the male reproductive system, and I realized that I neglected to cover the cultural considerations for breast, so I will go back and do that, but let's continue to talk about the male reproductive system. Cultural considerations. Penile cancer is very rare. It does occur, but it's rare, and it accounts for about 10% of male cancers in Africa and South Africa. So it's rare in the United States, I should say, and among Caucasians, but there is a higher incidence in Africa and South Africa. Prostate cancer is more common in African Americans than in Caucasians, and testicular cancer is more common in Caucasians. And as I mentioned, I missed this slide earlier, cultural considerations for breast cancer. And this is talking about women, even though men do get breast cancer, we're talking about women here. African American women are less likely to get breast cancer. However, it's important to know that African American women who get breast cancer are more likely to die from it. So it tends to be more aggressive when African American women do get breast cancer. Asians are less likely to get breast cancer, but it's more advanced when they do, and Hispanics have a lower incidence of breast cancer. This video shows how to teach somebody how to do a testicular self-exam, and it uses the testicular models similar to what we use in class and what you'll be using to practice.
Hello, we will be demonstrating the proper way to perform a testicular self-examination. TAC should be performed at least once a month, and any abnormalities should be examined by a healthcare provider. The best time to examine your testicles would be during or after a warm shower. First, cup your testicles under one hand and feel the weight. They should be about the same weight, but it's common if one hangs lower than the other or is slightly larger. They should feel firm but not hard. Step 2, using both hands, examine one testicle at a time. Place your index and middle fingers underneath the scrotum and your thumb on top. Gently roll the testicle between your fingers, feeling for any lumps or abnormalities. Make sure to gently roll and not squeeze. Spend at least 30 to 60 seconds on each testicle and move on to the next. One important thing you should know is that in the back of the testicle, there is a cord-like structure called the epididymis. This is where your sperm mature. Be sure not to confuse this as an abnormality, as this structure is completely normal, and you should be able to feel the spermatic cord going up the testicle. If you do, however, feel any lumps or abnormal swelling, don't panic, but contact your healthcare provider immediately. Not all lumps are tumors, but if it is a tumor and you catch it early, it is 95% curable. Most common tumors are painless, pea-sized lumps, but they can double in size within 30 days, which is why testicular cancer is sometimes called the hurricane cancer. Be sure to look for any warning signs or symptoms such as heaviness in the scrotum, testicular discomfort, swelling, or change in size or shape of the testicle. So be sure to perform your testicular monthly examination. It could save your life.
That video, it's short, but it does give you an idea how to conduct the exam and what you should be feeling for. Again, the spermatic cord, you want to make sure that that's not being confused as for a tumor or an abnormal. That concludes this presentation. Please make sure that you do the reading. You will be responsible for any assigned readings, anything from your skills book, and anything from this particular presentation. Please ask your instructor any questions that you might have, and again, you will be allowed to practice with breast models and testicular models in class.